Africa Health Media Trends Report 2026 has challenged health stakeholders to invest in local media for life-saving solutions for the people of the continent. In the face of increasing pressure on health journalism due to public health challenges, the report draws insight from professionals on how to strengthen media for health solutions. Solomon Ajuziogu brings us up to speed on the report presentation to the media across Africa.
Good afternoon.
A cross-section of African journalists converge here on site in Nairobi and online across the continent. They are here along with some medical professionals at the Africa Health Media Summit for the presentation and discussions on the Africa Health Media Trends Report 2026, released by Fin Partners.
Media is a gateway to health knowledge, and we all know that. For millions of people, media outlets provide essential information that helps people improve their health, but also participate in public debate.
The report says that health journalism is under immense pressure in the face of escalating public health challenges. The report heightens a call for data-driven, homegrown storytelling solutions that strengthen journalism and help reshape how health issues are covered for life-saving outcomes.
Both healthcare professionals, healthcare communicators, and healthcare media need to do a much better job of explaining how science works and what makes science credible.
Health journalists and newsrooms are operating with fewer resources, credible data, and navigating shrinking health funding, the rising burden of non-communicable diseases such as cancer, diabetes, and mental health conditions, recurring infectious disease outbreaks, and the accelerating health impacts of climate change.
Journalists mentioned that there is a specific focus on non-communicable diseases. And surprisingly, especially a surge in NCDs in young people and persistent infectious diseases. We also heard that donor cuts were affecting diseases such as malaria, like I mentioned earlier, TB and HIV also were coming up, which was pushing countries, from what we heard, to focus on local manufacturing and an increased push for domestic health financing.
The report advocates strong health systems through strong media ecosystems.
Whether we're communicators on the corporate side of things or on the media side of things, give people the tools they need to evaluate the sources of information that they are relying on.
Despite the challenges, journalists are eager to tell impactful stories on health that shape trust and bring positive outcomes for the good of the people.
There is massive opportunity here in the responsiveness between content creators and between journalists in supporting one another to deliver bespoke content that is very much relevant to the environment, to the country, to the village, wherever that may be.
The Africa Health Media Trends Report 2026 concludes with a call to action to invest in local journalism and build long-term trust-based partnerships with media to strengthen public health outcomes. Solomon Ajuziogu, TVC News.